Welcome to the HIV LLC channel. If you're a health or program leader working to improve health outcomes and tackle health disparities, this channel is for you. Our mission is to empower leaders like you by providing interdisciplinary insights and actionable strategies that benefit vulnerable and minority populations. Welcome back to HIV LLC, where we empower healthcare leaders like you with actionable strategies to lead your teams effectively. As we approach 2025, now is the perfect time to reflect, regroup, and set realistic goals for your teams. Today, we'll explore how you can foster growth, inspire development, and create actionable plans that make a real impact. Ready? Let's get started. In healthcare, we often focus so much on patient outcomes that we forget to invest in our teams. But research shows that clear, actionable goals can boost team morale, improve performance, and even enhance patient care. Whether you're leading a small clinic or managing a large hospital department, setting goals helps you create a roadmap for success. So how do we set goals that are meaningful and achievable? Let's break it down. You might already know SMART goals, but let's take it a step further with SMARTY goals. The additional letters, inclusivity, and equity add an important dimension, especially in healthcare. Be clear about what you want to achieve. For example, instead of saying, "We want to improve patient satisfaction," say, "We want to increase our patient satisfaction scores by 10% in 6 months." Define how you'll measure success. Will it be through patient surveys, team feedback, or performance metrics? Having measurable outcomes ensures you know when you've hit the mark. Ambitious goals are great, but they need to be realistic given your team's resources and workload. Stretch goals are motivating, but they shouldn't feel impossible. Ask yourself, does this goal align with our team's purpose and organizational mission? Goals should support the bigger picture. Set a clear deadline. For instance, we'll achieve this goal by June 30th, 2025. Deadlines create urgency and accountability. Ensure your goals consider everyone on the team. Inclusivity means valuing diverse perspectives and creating opportunities for all team members to contribute. Make sure your goals promote fairness and address any disparities within your team or patient population. For example, focus on closing gaps in care for underserved communities. SMARTY goals help ensure that your objectives are not only actionable but also aligned with the values of inclusivity and equity that are so critical in healthcare. Goals should go beyond metrics. They should also foster growth and development within your team. Here are some strategies to help your team thrive in 2025. 1. Encourage continuing education. Support your team in pursuing certifications, attending conferences, or taking online courses. Set a goal to allocate budget or time for professional development. For example, our goal for 2025 is to have at least 50% of our nursing staff complete a certification in their specialty. 2. Provide constructive feedback. Feedback should be a two-way street. Regular check-ins help team members understand their strengths and areas for growth. A helpful tip is to set a goal to implement quarterly one-on-one feedback sessions with every team member. 3. Foster a culture of collaboration. Encourage team-building exercises, cross-departmental projects, and brainstorming sessions. Collaboration leads to innovation. By Q3 2025, we aim to launch 3 interdisciplinary initiatives that address patient care improvements. 4. Recognize and reward achievements. Celebrate milestones, big or small. Recognition boosts morale and encourages continued excellence. Create a monthly recognition program to celebrate individual and team achievements. 5. Focus on leadership development. Identify team members with leadership potential and create mentorship opportunities. Succession planning is key to long-term success. By the end of 2025, we aim to enroll 5 team members in a leadership training program. Goal setting isn't without its challenges, especially in a high-pressure environment like healthcare. Let's address some common obstacles and how to overcome them. 1. Time constraints. Break goals into smaller, manageable steps. Even small progress is progress. For example, if your goal is to implement a new patient intake system by June, break it down into milestones like selecting a system by February, training staff by April, and running a pilot program in May. 2. Limited resources. Be resourceful. Look for free or low-cost training options or consider reallocating existing resources. An example is to partner with a local university for student interns or leverage free online resources like webinars and open access research. 3. Team buy-in. Communicate the why behind each goal. When your team understands the purpose, they're more likely to commit. If the goal is to reduce patient wait times, share data showing how it improves patient satisfaction and reduces staff stress. 4. Competing priorities. Rank goals by urgency and impact. Focus on high-priority objectives first. For example, if your team is short-staffed, prioritize goals like recruitment or streamlining workflows over long-term projects. Setting goals is just the beginning. Tracking progress and celebrating success are equally important. 1. Use goal tracking tools. Consider using tools like Trello, Asana, or even a simple spreadsheet to monitor progress. For example, create a shared Trello board with columns for in progress, on hold, and completed to visualize the status of team projects. 2. Regular check-ins. Schedule monthly or quarterly reviews to assess what's working and what needs adjustment. Hold 15-minute huddles every Friday to quickly review team progress and address roadblocks. 3. Celebrate wins. Whether it's a team lunch, a shout-out during a meeting, or a small token of appreciation, celebrating milestones keeps morale high. For example, when a team hits their patient care improvement goal, host a small pizza party or award certificates of achievement. Remember, celebrating success isn't just about meeting the goal. It's about recognizing the effort and teamwork it took to get there. As 2025 approaches, let's commit to setting goals that inspire growth, foster collaboration, and create lasting impact. Whether you're focusing on patient care, team development, or personal growth, every goal matters. If you found this video helpful, don't forget to like, subscribe, and share it with your fellow leaders. Let's make 2025 a year of progress and possibility. Here's to a successful and impactful 2025. You are making meaningful change.